Are you able to see my screen?
Yes, we are.
Perfect. Thanks for joining, everyone. Today, we're going to be going over the ED virtual training call. I'll be going over the launch point, so where all the physicians are able to see their patients in the rooms and waiting room. I'll then be going into the ED workflow, creating an ED notes, and then going over how we place a disposition for the patients. So, different from our other sessions, when the ED providers come in, they're going to actually be logging into FirstNet. And this is going to be their homepage, what we call the launch point. Similar to how we get to our homepage in the other venues, there's a button up here at the top that will take us back to launch point. So let's say if we navigated to the patient list or went to that message center that we're familiar with, we could go back and click launch point here. We're going to go back to our main screen. We're going to see all of our patients in the ED. So the first thing the doctor is going to want to do is they're going to check in. So if I come to these three lines over here to the top right and check in, this is like me signing in to launch points. I'm going to establish an ED provider role. I'm just going to set it as a default, so I don't have to do this again. And then the important decision of picking your color. And then from there, we can hit OK. And this is going to allow us to assign ourselves to the patients. So going over some of these buttons and metrics up here, usually it's going to at first be a little bit messy this way, showing you some empty beds. So I typically will have the providers take this off. So now we're only seeing patients in a room, and usually actually by default, they won't see the waiting room. So we'll want to make sure that's selected as well.
I have a question.
Yeah.
If you have the empty beds turned off, but a room has been put on hold, how does that show for the provider?
Like the patients in ED hold waiting for a bed in the inpatient space.
No, what if the ED room itself has been blocked by putting it on hold for an outpatient?
Hmm. Usually they'll be coming in like as it's like pending arrival or something. They'll usually have still show up in like this like waiting room state. So it'll be more like this.
So
Um,
these patients are like for outpatient infusions that are occurring in the ED.
yeah. Yeah, so they're usually placed in like this kind of like middle status. I don't know the exact like mnemonic or the abbreviation for it, but they'll still be able to see like, oh, the patient's name and then their status of like this is on hold for this patient. Because usually if they'll have like the infusions and like have a bed on hold, they already have a patient, or those are like kind of always placed on hold. And then like once the patient arrives there, you put in the information. How does that work?
Sorry, could you show me that one more time?
Yeah, no, I was just asking like for these patients who are going into the infusions in the ED, do
Yes.
you will you put the bed on hold and then have the patient's information, or that bed is always on hold and then whenever a patient like comes in or a schedule is an appointment is scheduled, then you put in the information for registration. Does that make sense?
They didn't really cover that when we went over that. It was just decided that if a patient was having an infusion in the ED,
Yeah.
they would be admitted to the inpatient in a bed. So we would have to put the ED room on hold.
Okay. So yeah, it would probably be something like this if you're going to be able to see it in launch point and not the patient list. I could talk to how registration is going to do that. But then I mean if they ever do need to go ahead and search the empty beds because it's going to
Right.
show up there, then they'll just toggle it. It's not that big of a deal.
Okay. Thank you.
No problem. Yeah, I usually just have it taken off just because otherwise like some of the ED providers don't want to have like all of these empty ones. They want to be a bit more streamlined.
Okay.
Some of the other buttons up here at the top is if I assign myself to any patients, I can go ahead and select my patients here. And it'll show me all the patients I'm assigned to, along with there's that tab here that will show you just your patients versus all the ones in the ED. There's also some buttons for critical results. So if any patients have critical results, like these have some critical vital signs, it will filter that down. And then any that have no disposition, if I select that, it'll show me. Some other metrics, they'll show you some of the my patients measurements, so how many you've seen in the last hour and today, and along with the departments. Last thing up here that I want to go over is this checkout list. So let's say a patient was discharged, then you want to go ahead and go back to their charts. You can come here to this checkout list, And then you could search patients that have been discharged in the past 12 hours, 24 hours. There's custom if you want to go past these defaulted time frames. Along with, you could filter it down to my patients, actually show your like unsigned notes. So this is a handy tool that we'll get a lot of providers ask about. Any questions before I start assigning myself and go over like the contents here? Okay. So to assign myself to a patient, I am going to come down to this ED or EP column, and I'm going to click on this blank space. And then from here, it's going to allow me to assign myself. If you are utilizing any scribes, or maybe a nurse wants to assign a doctor to a specific patient, there is an option to assign other people. Or sometimes we'll see if there's like two providers on the floor and both of them assign themselves and didn't realize somebody else assigned themselves, they'll go ahead and take off one of the providers and assign themselves instead.
And can they designate what time they're signing up for that, where their first view of the patient is?
So once they assign themselves, that timestamps that of like once they'll start the time of like, okay, now a patient or a provider has assigned themselves to the patients.
So what if the patient like comes in the trauma room and the doctor doesn't have time to sign up for them and they go into the trauma room to see them and then come back to sign up for them? Can they post date that time to when they actually saw the patient?
No, you can't backdate that time. You can always like place in the documentation that you actually saw this patient when they arrived.
That that has that has me concerned because we have like door to doctor time that we have to meet certain criteria for,
Yeah.
and I don't understand why they can't put in the time that they're seeing that they can't put the first time they actually saw the patient.
Yeah, no, I haven't seen, let's see if we backdate anywhere here. No, I haven't seen anywhere where they could backdate that. Like I said, that's where the whole like having other people assign doctors to the patient comes in handy. I'm not sure if anything like in HIM or one of the other solutions has the
So
ability to.
how does
Mhm.
Cerner handle their door to doctor time if they can't put in when they actually first saw the patient?
This is what drives the door to doctor time.
Our doctors are going to have a problem with that. Can you put that as an item for us to talk about further?
Yeah, sure. Um, Yeah, so this is how they would assign themselves. This is what drives that door to doctor time. Coming from like the left to right on these patients, this is going to show you their room, and this status bar will correlate with the status of patients here. So if they're pending arrival, will be purple. If they don't have a provider assigned, it's going to be yellow, and so on and so forth. This is going to be their acuity level. You have the patient information here, along with some icons that if you actually hover over, it'll give you some more information like allergies. I think there was, yeah, a DNR one, ED, pre-arrival notes. This will show you who has assigned themselves to the patient, so the RNs or sometimes like APPs you'll see here. Their diagnosis or chief complaints. There's also an option to have some staff comments or provider comments here that are kind of on the front end, but don't like flow into the patient's charts. So if you wanted to, the nurse want to say that the patient is back from X-ray. They can go ahead and do that. You'll have your vital signs here. By default, they'll be collapsed, but you could expand it here. And you'll notice that similar to how we're in the workflow before, any vital signs that are slightly elevated, like this patient's a bit hypertensive, is going to be orange. If it's below reference range, it's going to be blue. And then any critical vital sign is going to be highlighted in red with the exclamation point. All of these, along with like the labs, EKG, radiology, are like badges that if I actually click onto, it'll give me like this expanded window, and then I could actually tap to them here as well. But if you notice, these badges also have this bar underneath. So if there's any medications placed, it'll be ordered until it's like completed and administered. Then the bar will fill up to green, and then they'll let the provider know that's been completed. Same thing with labs. As they like are collected and the results are coming back, that bar will slowly fill up. And if there's any critical labs, it's going to have like that highlighted red, similar to the vital signs here. If any radiology came back, they can also like click on it. Usually when the report is back, they could expand this, see the findings and impression, and then also there will be a icon to go ahead and like view the radiology image that we'll go over in later calls. You'll notice that I have some order favorites here. So this is one thing that will help the ED providers, especially set up in concierge, where they can have some of their like frequently ordered labs, radiology, medications here that, you know, let's say they're reviewing the labs, like, oh, well, I need to order a troponin for the patient, it's a D-dimer. They could just click on them here and it comes to their cart similar to the workflow. And then they can just sign off on that. So it lets them avoid having to go into the patient's chart. They could just quickly place orders in from here. And they could do that for any of these, the EKGs, radiology, for patient care, also for consults. They can have all their launch point order favorites, we call them, set up here. Any questions about this?
I'm good, thank you.
Okay. They can also just open up into the patient's chart or go to their orders from here. But if they just want to place them, then let me actually cancel these. So yeah, that's a good thing that we can have set up, and a lot of the providers really utilize that. This right here will be some physician notifications. They actually don't have to, like, it's not going to be a hard stop to address these, but they're reminders of like some cosign orders they need to place, or sometimes like labs to review. And if they click on that, it'll go ahead and give them the opportunity to come and review those cosign orders, and they can just go ahead and cosign.
And so any verbal order will go into that cosign queue, correct?
Yeah, so verbal orders, the only time is like if they put like no cosign, or like written, sometimes that won't come over to the cosign. But yeah, the verbal ones will come over here as well.
Okay.
This is length of stay. Hopefully won't be as long as this. But they could also, a lot of the times the providers will filter out and arrange them based on length of stay this way. And then the last two columns are going to be any documents that have been started or completed on the patients. And then they can go ahead, if they wanted to take the opportunity here to like add the document, they could hit this plus icon and it'll take them to the documentation section in the patient's chart. Any questions about launch points? Okay. So if I wanted to go into a patient's chart, I could just, oh, one last thing that I did bring up. If I actually click on this like blank space, I didn't go over the patient summary before, but this will give pretty much like a lot of the information the launch point is giving me. But it'll open up and it'll give me some additional info like family history, procedures, or social history. So a lot of times providers will go ahead and quickly look at that to see if there's any like medical history before they go into like triage or see the patient in their rooms. So once we open the patient's chart, just like all the other venues, we have the patient's name here with some of their additional demographic info and their workflow, where these workflows could be arranged. If there was something additional like pregnancy view and provider never really like sees OB patients, they could go ahead and exit that out and now stay for the next time they open up a patient. Along with within their workflow, we have these components. These components are going to be the things that we fill out or review to ultimately make our ED note at the bottom here. Anything here could be arranged in a different order. Things could be subtracted or added by coming to these three lines in the top right.
They can't remove anything that's required, can they?
In what sense? Like the HPI or something?
Yeah, like the problem list or the home meds, they can't uncheck that so that it doesn't show up in the list.
So problem lists, educate the ones that say locked here, they cannot take out.
Okay,
Everything else they technically can, but
okay,
we wouldn't recommend it.
yeah. It looks like those are the requirements. So,
Yeah.
okay. Just making sure.
Yeah, no problem. But yeah, as you see, any of these you could deselect and have a check mark and go ahead and arrange them on the component list. I often say, and I think it's already checked off, but opioid reviews sometimes won't be checked off by default, so we want to make sure that they have that checked. So because that's where they're going to review the PDMP information. But then they can go ahead and take out things that they feel that are a bit like redundant here, just to streamline their workflow. And then this will stay for every patient that they open up. So going from the top to bottom here, first thing that we have is the triage review, where we have another view of their vital signs that they got in triage, their chief complaint up here at the top, how they arrived, excuse me, and some additional info that the nurses obtain in the triage assessment. We have their chief complaint here that we can modify if we want, if it really wasn't chest pain, or they also have like a complaint of dyspnea and we want to note it here, we can. Vital signs you can view here along with like those hues indicating that they're outside of reference range. If they had multiple vital signs, you could click on the actual title here and it'll give a trend of like the different measurements that they could view. In most of the components, you're gonna see these time filters that they can have for like just the selected visits or see how they have been like over time. We have the problem list here. So this is where the physician is going to place their diagnoses. There's this drop down that also allows them to place chronic problems as well. So if I wanted to go ahead and just put chest pain here. And I could put the dyspnea. And then I could put these for now, and then as findings come back, I can go ahead and place additional diagnoses. If I wanted to add like hyperlipidemia, I would just switch the chronic and then go ahead and add that right there. If any of these were addressed in the visit and let's say like hypertension was something that was an issue, I can go ahead and select this visit and then they'll make it a this visit diagnosis as well. I could switch the priority of these for the things that I felt I addressed more during the visits. Anything that the patients previously had and now is resolved, like a sinusitis, you can go ahead and hit the resolve. But if I added something by mistake, so this chronic issue isn't really a chronic issue for this patient, I would go ahead and just uncheck this and then it will remove it. Last thing here is that there is a section to see resolved chronic problems. So like, let's say I resolved this hyperlipidemia. It'll show up here at the bottom. And then as the patient has more encounters and visits, you could see that this visit problems here at the bottom. Any questions on the problem list?
No.
Okay. We could review allergies here, the severity of the allergy. If we needed to add an allergy, we could, rating this plus. We have histories that we could review, family history, social history that was gotten from the intake that the nurses completed, their procedure history. It gives us an opportunity to add procedure history if we needed to. We could add additional details and save if we know them. This is where we would do our med rec. So we see our home meds here. Something I always mention is that The meds history does have to be completed by nursing. If there is not a check mark here, it will not allow the provider to do their admission or discharge med rec. Once I place some orders and finish the documentation, we'll circle back to this and I'll complete the admission or discharge med rec. Here you can review past documents. So this patient has an office clinic notes that I could review. If there was something that I wanted to tag or copy to pull into my notes, I could highlight anything from previous documentation. So if it was, I saw this patient in the ED a couple days ago for their abscess, I can go ahead and highlight their physical exam and then make changes, obviously, in the note if I needed to. But if I highlight and tag, then it's up here in my tag icon, so I could drag it into the appropriate component. There's also this change filter option in the document section where I could filter it down to just ED notes or clinic notes. So if I just want ED notes to show up here, I could do that. Next three things we have here are going to be those narrative sections. And I do like to show this contextual view that we have available. So I'm going to change the resolution a bit so we could see it. So once, as long as your monitor is big enough or the resolution is changed, there's going to be this icon here. On certain sections, it's going to be mostly on the HPI review systems, physical and assessment and plan. That'll allow you to do like this split screen view. So I could click on that. And then these will stick here. And it'll stay this way for the next patient that I open up. And so I can go ahead and do my review like I was doing for, this office clinic note or if I had an ED note while I do my documentation on this side. And because I was mentioning the whole tag process, instead of like coming here to tagging it, coming up here to my tagged icon and dragging the information, if I have this view, I can have this split screen, highlight what I want, and then drag it. So it saves me a step or two. But these sections, the provider can go ahead and free text in if they needed to. They could dictate if they're using Dragon. They could use some of their own auto text or the public auto text that we have in Cerner, like this review of systems. Or they can use that tagging functionality, obviously. Now, the ones that I'm pulling in here are the public auto text and the global auto text that Cerner has available. If the provider is looking at this and they're like, well, this isn't very accurate to what I ask the patient each and every time I'm in the room, this can be modified along with they can make their own from scratch. Anytime that they see this icon here, this manage auto text, it doesn't matter where they click it from, it will take them to their library of auto text where they can make one from scratch. If they hit this plus icon here, which essentially gives them this like blank slate where they could paste paragraphs for procedure notes or just a couple sentences and then make an abbreviation where they'll type in and pull in that auto text. Or if they want to view the public phrases, there is a tab for the public phrases here. And there's about, 50 pages here where they can go ahead and search through. So let's say review systems. I could click on them to see which one I would like. The brackets, I don't know if we've reviewed this before, but the brackets are helpful for people who like to dictate frequently. Because what will happen is that if I place in this auto text and I say next field, it will highlight the bracket and all the constants inside of it. So I can go, subjective fever, next field, mild eye pain, next field, mild nasal congestion, next field, and it will replace all the constants inside with what I'm saying. So some providers really like that, and some of them will utilize that when they do like their procedure notes. But that's just a difference of why we have brackets versus some of these that are more like click heavy. So let's say I wanted to use this drop down. I can go ahead and duplicate here. The left portion is what I'm going to be modifying and saving for myself. So I can go ahead and delete or add anything here. if I think this is more appropriate in my exam. I don't ask these every time. Um, I want to add something here. I can go ahead and do that, make all the changes I would like, and then I could change the abbreviation, and I'm going to use an equal sign or like a dollar sign, put my initials, and then the description of what the auto text is. And I'm going to show you why I do that in a bit. But after we make our changes, put our abbreviation, we could hit sign at the bottom right. And now you see that is in my phrases. We can always go back and edit this, change the abbreviation, change the contents. But now once it's there, I could, well, let's say we go back here. I could come here, press equal, and then enter, and then that will load in my new auto text. What I show is that if we use period or like backslash, for example, Cerner uses a lot of these when it comes to the global auto text. So that's going to, this having a one that Cerner doesn't use just kind of streamlines like just utilizing your own auto text. And this doesn't matter if other providers or like Becky uses equal sign, those don't won't like interject, and then you won't pull up hers by putting equal sign, only the ones globally. Any questions about that?
No.
Now, last thing here, especially for the ED providers, we'll see this utilized a lot. For the HPI, there are things for drop downs like this that we were doing, but also for smart templates. So if we press the add here, and this doesn't necessarily have to be used for HPI, but just to show you the functionality. There is this icon here when you're making auto text from scratch, this paper and plus. And this are what we call smart templates. So it will pull in information automatically from the patient's like registration and documentation. So like their acuity, labs if they had any labs, some of their, let's see, administrative sex. So if I do age, I'm going to want to make sure that I get a preview here of some data. And then I could do presents with and leave an underscore for my chief complaint, which onsets, and then I could put a drop down. And this drop down could be also utilized for like the physical exam or review systems. For this one, we'll do like 2 days ago. Yesterday, 1 week ago. But I know I've mentioned before, if like they wanted to make one for their like heart exam and do like, you know, systolic ejection murmur, or even do one for like their auscultation. They can have these different drop downs, customize them as much as they want, change the order of them, have one as the default, and then create that so it saves for their auto text. But once I have that created, again, I'm going to do my abbreviation, save it, and then that will pull in. This is just letting me know I'm using this auto text. Pull in some of the information automatically from the patient's charts, and then they can go ahead and make the changes, the things that change. This F3 that I'm clicking on my keyboard, F3 will take you to these different like underscore drop downs so they can quickly fill them out, along with, again, remember that next field functionality is available with Dragon, where they can go ahead and just say next field and it'll bring them to both of those. Any questions about that or anything I've gone over before I move forward?
No.
Next thing I'm going to go over before we continue on this component list is placing orders as the physician. So we do have some auto text. So, I mean, it's not auto text, some order sets. So we can go ahead and go to this dark blue menu and hit the add here. And so if I wanted to place an order set for this patient, it's always going to be ED for my ED order sets. I'm going to know it's an order set because it has this yellow square with the shapes inside. We're going to just do the chest pain one. Once I click it, this is a common thing where the provider's like, well, what happened here? And they'll like go ahead or like click this again. If you notice, once it's highlighted in blue and I click it once, it's over here in the background. So sometimes when we see providers have multiple order sets there and maybe make changes and actually initiate multiple, they probably selected this multiple times and then they are just like duplicated here. So if that happens, you can just hit done here. You can actually right click and just remove the duplicates. But just a training point of like, they can click it once, it's going to be here in the background, and now we can make the changes. So these are still being worked on, but ideally, once this order set is completed, you can go ahead and select things that are frequently ordered for chest pain patients. And I'm just doing arbitrary clicks. Some of these will have order sentences. So instead of having to go into the order details, you can actually click this drop down and select the specific order sentence and order details. This one actually looks like I need something else here. We could deselect that one. Let's say for this one, I could select here. And then, yeah, it will satisfy like the frequency and all the other order details that I want. Some of them will not. So like you saw with that oxygen therapy or this chest x-ray, I don't have an order sentence, but if I right click on here, I can modify. And then the yellow fields are going to be the things that I fill out and that are required. So I can just put chest pain here. Once I click out, now we don't have that blue circle with the white X. So there's no additional details that are required. Now, once these are completed, and let's say these are really accurate to the orders most of the time that I will place for my chest pain patients, the provider has the opportunity to save as my favorite. So save their order set as a favorite. So I could do that. I can go ahead and put in like GR here. And so that the next time, let me refresh and cancel this. So next time that I add here or here, if I was in the workflow, I can go to this star. They're going to automatically have this favorite plans made and where their order sets will route to. And now those selections are already there. So it saves me the time of having to go each and every one. Obviously here I can go ahead and modify if I needed to. One thing I didn't mention is that even if these order sets are completely validated and completed, and the provider says, well, this is great, but there's like a couple things that I want to add to this order set, there is this add to phase option here that will add an order to the order set. So I can go ahead and I can either put in like medication. Oh, I can go ahead and place like additional labs if I needed to. I don't know if D-dimer was on there. And then I'll have them here. And then let's say the provider always wants this for their chest pain order set, then they could save as favorite. And actually, I'm not even going to change the thing because let's say I just wanted to make changes to this favorite order set already. I won't change the name if I hit OK. It's like, do you want to overwrite this? And this is how they update their order set. So I don't know if we reviewed that before, but that's good to see. So then next time, if I add it here, it's going to have obviously the checked ones, but then the ones that I added to phase here.
If they put the medication dose in there, because that has the blue X by it, if they go ahead and put the dose, will it save the dose in the string as well? I mean, in the favorite?
Yeah, we could try it. Sometimes with how they're built, they will save, and I have noticed in other ones it doesn't. So let's see if like this one will save for us. Let's say this is just like okay, nice. So let's do that. Yeah, I think it will if we have it checked this way. Sometimes where it doesn't is I think if it's unchecked.
Okay.
So let's do it. Yeah, so you see, it's saved like the details.
Thank you.
No problem. Any, oh, and then yeah, if I did that, sorry. So then once I have these selected, if I go to orders for signature here, it may give me some notifications specifically about the aspirin and the renal function. I could overwrite that if I need to. It's going to give me a preview of what I'm placing, and then I can go ahead and just sign this. If I refresh up here in the top right, now these are the orders that I placed. And now this order set is done, and then I can place another order set if I needed to, or one-off orders. But any questions about placing orders, order sets, how I favorited them and customized it?
No.
Okay, nice. So if I want to get back to my workflow from here, I can either hit this little house icon or go back to the provider view. I'm just going to continue down now. There are a couple free text fields. Again, these work similarly to any of the other free text fields where they could dictate, they could just free type into there. They could use auto text. So they needed a place a procedure note for their IND or suture removal, they could do it here. EKG, this is where they're going to put their interpretation. Usually the EKG is scanned into the chart, but they'll place their interpretation here.
Where would they put their interpretation of the X-ray?
So do they typically write like an interpretation when they read the X-rays?
Yes, and then that
Okay.
way it's used for comparison.
Okay. Yeah. So there's a component. If they're going to be utilizing that, we probably want to have this checked each time. There's a diagnostic study interpretation. So it's just a
Okay.
free text field where they could write that.
Yeah, they use that so if the radiologist, after the reading, if there's any discrepancies.
Okay. Yeah, that's fine. So yeah, we could maybe put it just like under the diagnostic so they could like review it here and then like write in their interpretation if they need to. Okay. Same thing with medical decision making. They could put in like the critical care time spent here. I know this is like a field that a lot of the ED providers may utilize. Again, it's just free text that they can go ahead and put their information. Their assessment and plan, if you noticed, these problems flow directly from the this visit problems that I placed in this component. So that's something to keep in mind when they're doing the order of their components here. We want to keep the problem list first, which makes sense. So it flows to the assessment and plan. The orders will flow down here. This does by default, and there's no way to actually take it out from flowing here at the bottom. But if they need to remove it, they could just go ahead and exit it out there. They could write any additional details here. Use auto text, free text. Next thing that we have here is labs. If they had any labs that resulted from here, you could view them and actually, if we want to go ahead and just give you an example of how that looks. So let's say if I had a creatinine here, this is where I could go ahead and view that. Along with, remember, a lot of the labs they'll be able to see up front in this launch point. But if they're in the workflow, there's also some sections for them where they can go ahead and view them here. If you see there is that like trend option. So if they had creatinine, I want to see what this patient's creatinine typically is over the length of, 2 weeks if they were seen recently, or like even 6 months. I can go ahead and filter that out and then click on there and it'll give me a graph with all the readings down here of the creatinine. Diagnostics also, they will show up here if there's a report back, and I could see if I have any diagnostics in. Yeah. So yeah, this is how it'll show up. Any of them, sorry, that come in here will be placed automatically into like their categories. And if I would click on the blue hyperlink, this will show me any like findings or impression here. And let me expand this a bit. If there is like the physical radiology that they need to view, like the actual image, there is this view image, this portrait icon, and that'll bring up, the packs or anything like to view the actual image here. Um, One other thing is that if they wanted to go ahead and like tag any of this, so if they wanted to tag specific findings to put into their documentation, they can go ahead and do that. Like we were mentioning, they can have this diagnostic study interpretation to free text or interpretation here. We have their the order profile. And if you notice, this is actually I didn't mention it before, but one of the ones that have this asterisk, and we're gonna want to focus on this asterisk for any disposition that we do. The order profile component is just kind of a summary of the orders placed on this visits. So it shows these active orders from this order set that is placed, but there's a drop down to put inactive orders or all orders from the past 5 days. So this could be filterable. And then we're gonna do it, but this is just letting me know that an admit, discharge, or transfer order has to be placed for this patient. We have our opioid review. So this is where that PDMP information, like I referenced earlier, is going to flow into and be integrated for us to review. And then once we open up the reports, it's gonna select this certify that I reviewed it, and then I can mark as reviewed, and that satisfies. We have this patient education that is going to load some suggestions based on my diagnoses. I could change the education language if I needed to. If I click on one of them, it gives me the opportunity to modify. Follow-up, it's going to have my name as a resource by default. I could click on that. If I needed to put something like, especially this is coming from the ED, you might not want them to follow up, only, return to ED if needed, and then you could put in the comments. Worsen.
What if they want them to follow up with another provider?
Yeah, I'll show you that right now.
Okay.
So I could save this as a template here. So yeah, if they want another provider, there's this option here to search for another provider. I don't know
Okay.
if they're loaded in already, but yeah, see, so like I could put in Joanne or Kevin.
Okay.
So yeah, they could just place that, and they could also save those as templates if they send them to these specific providers often. But yeah, then what's good is that they can have that like ED1 if only if needed, saved as a template, so then they could select that and not have it blank each time. And then there's this patient instructions, similar to the patient education, but this is going to be a little more free text. I don't see this utilized a lot in the ED, but it definitely can be. So any questions about these components before I open up the ED provider note?
Yes.
Yeah.
The med reconciliation is a required item.
Right.
So the nurse does their part, but the physician doesn't do their part when the patient first comes in on admission. Do they have to do it on admission before they can discharge the patient, or?
Okay, so we're talking about like in the ED or like when they
Yes.
come into like the inpatient space.
Into the ED?
Yeah, so in the ED, if they're not admitting them, then they don't have to do this admission one, right? Like they could just like, let's say I saw this patient, I don't think he needs to be admitted. I'm not placing a PSO or anything like that. I would go ahead and then just do my discharge, MedRec.
Okay.
And then yeah, once if they are admitting, then this is I guess like an internal thing. Usually we see the accepting admitting physician do the admission MedRec. And so the
Yes.
ED wouldn't touch this.
Okay.
Any other questions before I go into I'm gonna do this I'm gonna do the provider note and then I'll go into like the disposition stuff.
That's fine. Thank you.
No problem. So then I'm gonna come down here and then open up my ED provider note. Let me save this real quick. Then from here, you're going to see that all the information that I placed is going to flow into here. Time seen for the patients, some of the info for the HPI. I could fill out information here if I needed to. There's also auto text like I did with every review system, but something that I mentioned for like the labs is there is a dot labs and dot rad that will load in the radiology or lab for this specific time frame. But if I'm happy with this note and there's no other additional details, then I can just go ahead and sign and submit. And then I can sign my note here. So now my note's completed. Let's say I am doing I'm going to discharge this patient. I can go ahead and then make sure I'm following these asterisks here. So I did most of them. I did my patient education follow-up. Now I can do my discharge med-rec. Again, this is going to show the home meds indicated by the documented, and then these order meds are the ones that I placed in the hospital. So if I want them to continue on aspirin, I could definitely do that. I could place a prescription if like this isn't a home medication. So let's say if I'm prescribing 325, I guess I would do the 81 usually, but I could do that. I could fill out these details just for the sake of time. I'm not gonna do that right now, but I can go ahead and have them continue these if I needed to. One thing I want to mention is that, let's say I cancel this. If there was a bunch of medication, we really want to focus on, or like, let's say I have some like duplicates, we really want to focus on this continue remaining home meds and do not continue remaining orders, because that just makes it a lot easier. A lot of times the physicians want them to just keep doing what they're doing with all their home meds, and then don't want the stuff from the ED, except with their like a couple like prescriptions, so they can use those buttons and then make the changes there. Along with if from here they want to add a prescription that they don't have here, they can go ahead and do that. And they could just search anything. And then this has those order details that we were seeing before. I could change these things, put special instructions. But once I have all those details set, then I'm gonna look for this section to make sure that there's a pharmacy place and this isn't printing to the to like the printer. And then this will e-prescribe that medication to the pharmacy. So then I could sign this. And now have a check mark here for my discharge med-rec. Any questions on this?
Would they put the DME like for crutches in that same area with the medications?
They could, yeah. There's a let's see if that I don't know if that order has already been built out yet, but usually there's like a miscellaneous miscellaneous DME one. And I will usually see this not like sent to a pharmacy, but printed out actually. So this will be actually one of the ones that they will typically print out and give to the patients.
Okay.
But yeah, this is what they would utilize.
They'll ask about that one.
Okay. Then the next thing that we could hit here is our order. So we want to place that discharge or admit order. If I'm going to discharge this patient, I'm going to hit this add orders here. And then I'm going to place discharge patients. If I was admitting the patients, I could do a decision to admit instead. So it'd be, maybe it's not called that in here. Is decision. I'll have to see what the specific admin order is called. But for now, we'll do the discharge. And then we can go ahead and this one just defaults to home, but they're the same order. If I click this discharge patients, then I can go ahead and select what the specific one is. And so if I'm just going to do home independently, I can select that and then sign it. Now, if I go back to my provider view, I'm going to have all these check marks along with, if I go to launch point here in the top left, and let's refresh here. For my ED, this one might not do it just because it's looks like it's pending arrival. But let me see if I can show you. The status will change to like a bed, or if I probably did it on one of these, and I can if you want me to. It'll have a door instead when I put the discharge order. But you'll be able to tell that I completed my notes because it has this green check mark. And then my diagnosis flowed into the front here. There's also the option of like if I right click here and I want to go ahead and like discharge the patient quickly, I can go ahead and discharge the patient from here. And that'll place in that order. It's showing me that I have this order anyways, but that's a quick way that the physicians can do it just from here in the launch point. Any questions on that?
No.
Okay. So we went over the launch point. We went over the ED workflow, how to complete that ED notes, and how to place the disposition. Anything that we want to go back to review?
No, I know Lori has spoke with you about the PSO order if the patient's gonna be admitted.
Yeah. Do you want me to show you that now?
Yeah, let's just look at it.
Yeah. So let's say if we're doing that PSO. So this is for, just to clarify, this is for the after hours, right? They're not always placing this PSO? Or they
That should
are?
not be all the time, no.
Okay. So what they can do is, just so I slow down a bit, I went to the add order, I added this PSO. And so let's say in this case, I'm the ED provider and I'm placing this on behalf of the inpatient physician. I can go ahead and say, like, let's say they're going to med surge. Let's say yes, go to different bed, fill out these details. And then I'm going to want to go ahead and place the attending physician. So let's see if someone will pull up here. I can go ahead and put them there. I'm usually going to initiate this PSO. And am I missing something? No, doesn't look okay. I'm going to sign. What is it that I'm missing? So weird that it's making. Huh. That's weird. We might have to, I might reach out about this order. I don't know why it's not giving me this, why that's not being taken away, but let's place it anyways. No spelling code. Okay. And then, yeah, I'm gonna initiate this now. And then what I want to go ahead and do once I sign this is they're gonna want to right click and actually change the ordering position too. Because even though I place in that attending, it's still showing that it's like me placing the order. And if we're placing on behalf of the physician, so like let's say we're putting Kevin or Dr. Meyer, we can go ahead and put his name here. And then we'll usually do cosign required and hit OK. And that's what they need to do for that PSO order.
Okay.
And I don't know. I'll reach out to Karen about this now. It's weird because it's like I don't have anything yellow here. And then when I have it take me to this, yeah, I don't really understand. But yeah, that's pretty much the workflow. It's just a couple other steps.
Yeah, okay, thank you.
No problem. Any other questions before I stop the recording?
That's all that I have.
Perfect. Let me stop sharing.